Welcome to Talk Dizzy to Me, the show that brings you a comprehensive look into the complex field of dizziness. Now, here are your hosts, vestibular physical therapist Dr. Abby Ross and Dr. Danielle Tate.
Welcome back to Talk Dizzy to Me. I'm Dr. Abby Ross, vestibular physical therapist and neuroclinical specialist. Here with my partner, Dr. Danielle Tate, also a vestibular physical therapist. We are so happy, relieved, excited, all the adjectives really, to be wrapping up a great week of the first ever virtual vestibular conference. We, of course, ran into some issues, but what is a first ever annual conference, especially online, without a few issues? I think we successfully, though, had some great content, some great questions answered. We had a great audience. Thank you all for participating and joining us and encouraging us through our struggles.
Yes.
One takeaway from today, what a great presentation. Finally, we had a day that ran completely smooth. Shout out to Dr. Danielle Tate over there. But one of the takeaways from today on complementary treatment and alternative treatment and medicine, for me, it was, really what works for one person might actually exacerbate symptoms in another. So if this person with this vestibular symptom says, I had such great success with this particular supplement, and then the next person takes it, they might say, oh no, that did not sit right with me. So it's very patient specific.
Yeah, I mean, patient specific and even whatever you're recommending. So it could be a supplement, it could be an oil. Somebody brought up the fact that they found out they had allergies to certain essential oils. Another person found out that they were taking too much vitamin D. One person recommended yoga and Tai Chi, and one person came back to say that exacerbated their symptoms significantly. So, it can be frustrating to see other people do well on one thing and then you try it and it makes you feel worse. The whole takeaway, I think, from today and even from the rest of the week was that everybody is very individualized in what works for them, what is going to help them feel better, and what is going to help them get through their journey back to balance. So this type of a conference is great just to kind of open the doors for you to do your own educational digging into what could possibly be the right method for you to help you out to feel better. So we're hoping that we created a platform and at least an event for everybody where we put a lot of resources out there, a lot of information out there, and got you looking into what could possibly be helping. I mean, somebody from our patient panel yesterday, they basically got on top of their vestibular dysfunction by Balance Awareness Week 2 years ago by having the awareness raised from that. So we're hoping that this was something that really could contribute to helping you figure out what you need to feel better. These complementary and alternative medicines, I think, are actually very crucial to helping vestibular patients. Sometimes you can get lucky with finding that right medication for your vestibular migraine or something along those lines. But really, there's a lot of time and work that needs to go into it between when your symptoms start and when you finally reach your diagnosis. So we talked a lot about today decreasing anxiety and stress. And that could be as simple as getting a mindfulness app. I personally use Insight Timer with my vestibular folks, working on guided meditation and breathing and using that for sleep sounds and things like that. But those are some of the things that you can actually work on. Complementary and alternative medicine has different aspects to it. You can go the expensive route and go the cash-based, like acupuncture and supplements and seeing these different doctors that have a more holistic approach. Or you can kind of take those first steps and look at your diet. Look at, these free meditation apps, doing your free yoga and Tai Chi classes at your local community centers. So although you hear complementary alternative medicine and you think big bucks, there are still things that you can do just more on the homegrown level. Start with just those things that you can change in your life that aren't going to cost you a fortune just to kind of achieve.
Right. I mean, there is literally an app for everything now. Usually, at least a small part of the app is for free. Maybe access to the full app costs a little bit more, but I agree. I always recommend apps to help with those things, especially for those who are not necessarily willing or ready to seek more professional services through a psychotherapist, for example. Some of the apps are just great. The other thing too that stuck out to me was not only do different interventions. Do people respond differently to different interventions, right? So what works for you might not work for the next. But also, we kind of had that same theme come through today when it came to providers. So if you're not getting the answer, or they're not trying something that you'd really like to try, or they're not recommending you to vestibular therapy or whatever it may be, go to the next provider, because there are providers out there, maybe more rare, but there are providers out there who truly do understand vestibular disorders to the extent that we can, and, are really, really willing and eager to help.
Yeah, don't be afraid to get up, walk out, and find somebody else. I know it seems daunting to have to tell your story all over again and find a different provider who's going to be able to help you. But if you're not with the right person, you're not going to get the help that you need. So you could be prolonging your symptoms, prolonging your whole episode of care just by not being with the right person. It sounds like we had a bunch of patient panelists who, once they found that person, it made all the difference. Like Alicia today, Alicia Wolf, the Dizzy Cook, she found Dr. Shinbei, and he's just amazing. He spoke at Bridget Wallet's virtual vestibular conference. He just came out with a brand new book, which I've purchased and is phenomenal. It has the most up-to-date research and approach to treating vestibular migraine from all different corners, which also addresses a question that came up a lot today in the chat, which was using CBD or medicinal marijuana. You want to educate yourself, and you want to get with the right person. Somebody like Dr. Shinbei, especially since this pandemic, has opened his doors to people from all over the country now, because now we can do telehealth medicine and get people more access to practitioners that specialize in this.
Right.
So finding the right person is important. Finding the right approach is really important. Educating yourself is really important. And it feels like a lot of work, but when you put that work in, it does pay off. It really, really does.
And wasn't spoken about today, but I feel that support from peers with like symptoms is also a form of complementary and alternative medicine, because you heard story after story, right? Oh, I connected with Alicia, or I connected with Ashley, or I connected with Alex. And after talking to them, this whole new door opened in my treatment, or just even having that support. I feel like that's medicinal, right?
Yeah. Oh, absolutely. And look at what, so Alicia Wolf was one of our OWL, the One Who Listens award winners this year. She was nominated by countless people, and it is very well deserved. But she is somebody that has started this whole platform, this whole space and community for people with vestibular migraine. And she's been a rock for a lot of people when it comes to connecting and providing resources. And it was so awesome to hear her today that, she is pregnant, and she's going through this pregnancy, which they've been working hard on for a long time. And she has days where she's completely symptom free, like today. And she came out with this awesome cookbook, which I've purchased and love the recipes in, by the way. She's come so far, and she's created something because there was nothing.
Right.
And it's people like that really make a difference in other people's lives, and why we have Balance Awareness Week and awareness events and conferences like this, so that we can get the resources to people, because it is not talked about enough. I might be biased on that, but I feel like it is not talked about enough. So I agree. Have to say, this was just an amazing week. Even with all of its hiccups and glitches and issues, it's just going to be a learning experience for next year, where it's going to be bigger, it's going to be better, and we're going to have less problems.
Fingers crossed.
Fingers crossed.
Yes, fingers crossed. There was another point that I wanted to bring up too. Out of all the patient panelists that we heard from, I cannot think of one who said they figured it out within a couple weeks. Vestibular disorders are not a quick fix. They are not a quick learn. It takes time, the trial and error, different interventions. It takes time to learn your body and figure out what sort of coping mechanisms you have to initially implement in order to get back feeling well. I can't think of someone who was under like 8 months, honestly, before they found their path, which I'd like to encourage any patient that's listening who maybe was newly diagnosed or is still seeking a diagnosis, that this is a process. You will get there. There is light at the end of the tunnel, but it might not be tomorrow.
Yeah, patience is key. And unfortunately, a lot of us don't have it. I know if I was my own patient, I would be miserable. I like results and I want them now, but hanging in there and being consistent and really being your own advocate and educating yourself are some of the biggest takeaways that you can take away from this week. There are resources out there. There are people out there that want to help you. It's just a matter of utilizing those resources and finding the right people. So hopefully, if you're listening to this and you're just getting started, you're on the right track. Don't beat yourself up. Many have gone through exactly what you're going through, and there will be another side to this. There will be light at the end of the tunnel. Don't give up. Just don't.
That's right. And on that note, when we talk about how important education is, Dr. Google is great for some things, but maybe not for vestibular disorders. So make sure, and I think we provided plenty of resources, but we'll just recap a few now. Make sure you're using a reputable resource, something you can actually read, understand, rely on, know you're getting up-to-date information. So obviously, VeDA is one of them, vestibular.org, vestibular.today, of course, the platform that we're on. Balancing Act Rehab has resources on its website and Instagram. Dizziness-balance.com is also another great resource. Any others you can think of off the top of your head?
If you're looking for a provider, make sure you hit up vestibular.org and check out their provider directory. You can search for vestibular specialists in your area by city or zip code, or even look for a specific individual. If you heard any names on the podcast, on the webinars, or even in the chats, check out the Dizzy Cook. Her website has endless resources when it comes to diet, nutrition, apps. Products like the migraine glasses and the wine stirs. There are a lot out there. Check out social media. All of our patient panelists, if you go on the virtual conference website, we are linked to their Instagram and Facebook platforms where they have a lot of resources to share as well. A lot of them have provided their contact information so you can reach out. Keep in mind, the entire week will be available to watch at a later date. All you have to do is purchase it for $20, and that is just going towards VeDA and helping create more resources like we put on this week. It takes a lot of manpower, a lot of time and resources to make something like this happen. And Abby, I don't know if you can look at the bags under our eyes as we're recording on day 5. But there's a lot that went into this. So if you want to see
the bags under our eyes and the acne on our face.
The stress lists are they're terrible and they're painful. And I can't wait to take a week off from all of this.
Man. But we did have fun doing it. And we love to see the vestibular community come together. I honestly can't wait for the next one. I'm ready. I'm excited.
Give me a couple of days.
New presenters, everything. It'll be so fun.
Well, the nice thing is we've already been brainstorming. We would say, wouldn't this person be great for that talk? And wouldn't this person be great for that talk? And we can already start planning for next year because we've laid the foundation with this year. We know the things that we want to change. We know the things that we can do better. And we really hope that you guys come back next year to hear everything and to support us. So from the bottom of our hearts and from the people at VeDA and our entire vestibular community, thank you for such an amazing week. Thank you for being flexible and dealing with our technical glitches. This has been amazing. We cannot wait for next year.
Thank you all so, so much. And honestly, the audience is what makes this happen, right? It's a lot of work to go into it, but to see the chat lighting up, to see the questions, to see people commenting on, oh, will you do a presentation on this topic? That just got me so excited. And then also just to see everyone connecting with everyone, people following each other on Instagram, people sending DMs, giving you words of support, people commenting on your photos with words of support. It just honestly is so inspiring to me to see such a great community all in one place at one time. So thank you all, and we will see you next episode. Good night.